Good morning, I'm Rosalie, and today our focus is on prevention to help keep us and our families safer and healthier. While we learn more about new advances in type 1 diabetes and how to protect ourselves from those around us with respiratory infections so that we can enjoy a healthy life and take a vacation, all when we return. Do you have a plan to keep your family safe from fire? We all need to think prevention. According to the National Fire Protection Association, last year, residential fires accounted for 76% of all structure fires in the U.S. and 77% of fire deaths of residents in their homes. Well, winter safety prevention preparedness includes heating equipment, the second leading cause of U.S. home fires. Here to help create fire safety awareness to prepare your home and in case of an emergency is Dave White, home improvement expert from the Home Depot. Good morning, Dave.
Good morning.
So tell us, Dave, where do we start looking around the home for potential fire hazards?
Yeah, I think the thing that I like to recommend first is just to make sure that you can be alerted to a fire if one happens. So, one of the easiest things you can do is to ensure that you have a working smoke alarm on every floor of your house and in areas around bedrooms and places like kitchens and even in your garage or attic. Most people don't realize this, but even if you have existing smoke alarms, after 10 years, they can really become ineffective. The sensors can wear out. So you really need to actually replace those after 10 years. A good rule of thumb is toss at 10, start again. Pretty simple, right? And when you replace those, they've changed a lot. There's a lot of innovation. We've worked with our partner Kidde, who I'm sure you've heard of. They're one of the leaders in the fire safety industry, to develop some really cool new products that even make it safer for you and your family. For example, we've got this the 10-year sealed battery smoke alarm, and it actually has intelligent wire-free interconnect. I know that sounds complicated, but the great features about this are it's got a sealed battery that lasts 10 years. You're not going to have to replace the battery ever. After 10 years, you just replace the whole unit. It's intelligent. They actually speak to each other. So you can have up to 24 of these in your home around the house if you need them. They will talk to each other. For example, if you have a fire in a basement and you're on a second floor, that alarm alerts all the other alarms throughout the home so that you get that both an audible voice alert. It'll tell you, hey, there's a fire in your home. Also, it'll give you a beep and it will even alert your smartphone if you connect it up to your Wi-Fi as well. So installation on those, again, they're wireless, so you don't have to hire an electrician. You just mount them up to your ceiling and you're good to go.
So the National Fire Protection Association reports a home fire occurs every 88 seconds. And the most vulnerable are those older and over 65. So what advice can you offer?
Well, one thing that we like to talk to people about is prevention. There are a lot of really simple things you can do. You mentioned that the heating and air systems can be a leading cause. Make sure that you have maintenance on those every single year so that you know that they're up to spec. Make sure that you're careful and you don't leave fires unattended if you use the fireplace. Be careful with space heaters and things like that. And you know, young children, obviously, you know, they're roaming fingers. Just make sure they know how to be safe around those things as well. Having fire extinguishers around the home is really critical. And in most cases, a small fire can be extinguished without becoming a big emergency. So again, sort of similar to the smoke alarms, you want to have those on every single floor of the home. And those are rated for different types of fires. It may sound complicated, but really all you have to do is look at the packaging to tell what kind of area they're good for.
One problem in fire prevention is most of us don't even know how to use a fire extinguisher. So where do we start?
So one easy thing to remember is PASS. It's a great way to remember how to use the fire extinguisher. It's very simple. The P stands for pull. That means you pull the pin. The A is aim. You're going to aim it at the base of the fire. Then S for squeeze the trigger. And then the other S is for sweep. side to side at the base of that fire. It's pretty simple. You don't want to actually use the fire extinguisher in order to practice because you'll deplete it and then you'll have to buy another one. But at least get familiar with where the pin is and again, sort of the weight and the feel of the fire extinguisher.
All right, Dave, tell us where our viewers can learn more.
Just come on into the store at Home Depot, talk to one of our associates, or go to homedepot.com/fire safety.
Thanks, Dave, for helping create awareness of the importance of having a fire safety plan to protect our home and our family.
Thank you.
We all want to prevent catching influenza or the flu. It's a respiratory infection that's passed through the air and enters through our nose or our mouth. Flu is easily spread from person to person, leaving adults 50 years and older with chronic medical conditions in serious risk. Joining us this morning is Dr. Mai-Lin Han, an American Lung Association volunteer, medical spokesperson, and expert in influenza, pneumonia, and respiratory health. And JoJo O'Neill, a radio personality living with asthma who became ill with flu and passed it to her sister and niece and felt terrible about it. Good morning, ladies.
Good morning, Rosalie.
So, Doctor, why is it so important for people over 50 years old to be more proactive in preventing catching the flu and taking the vaccine?
Well, thank you, Rosalie. So the flu can affect anyone and can be devastating in anyone, but particularly for people over 50 or for those who have chronic medical conditions like asthma, like JoJo, or COPD, diabetes, heart disease. For those patients, what can, in some people, just be, say, 2 weeks at home. For patients with a chronic medical condition, the flu can actually turn into hospitalizations or even death. It can be incredibly serious. So for patients that are over 50 or have a chronic medical condition, we're here today to get out the word about the importance of getting the flu shot. Or if you have a loved one that's over 50 or has a chronic medical condition, I see patients at the University of Michigan in Ann Arbor, and there unfortunately are a lot of myths about getting the flu shot that we're here today to try to bust some of those. But a lot of times I do struggle with trying to convince my patients to get their shot. So one of the things that I do try to talk to my patients about is, even if they won't get the shot for themselves, the importance of getting it to protect your loved ones.
All right, doctor, so share some flu effects on our lungs and our respiratory system and how critical it is to our health in a number of ways.
Yes, absolutely. So influenza is spread via respiratory droplets. So that can, for some people, it might be coughing or touching something that's infected. Unfortunately, it's incredibly easily spread. Once the virus sets up in the body, it can cause things like body aches and fevers. But for some patients, it can actually go into the lungs and cause pneumonia. One of the things that can be incredibly scary, though, is that influenza in particular can then set the body up for what we call a secondary bacterial infection. And so it starts off with the virus, and then you get something else on top of it. And that's when we see patients that end up hospitalized or even in the ICU on breathing machines. So it can be incredibly scary. And unfortunately, this year we've already seen cases of influenza, and we've already seen influenza-related deaths already. The CDC recommends that people get their flu shot. So we're here to get out the word. If patients aren't sure where to go, we have a website, getmyshot.org, where they can get information not just about the flu vaccine, but also where to get it in their area. They can type in their own zip codes and get more information.
JoJo, you suffer from asthma. Share your experience with this condition when you caught influenza virus, and did the virus affect you more severely because you have asthma?
I'm not sure if it affected me more severely because of the asthma, but just having asthma and being over 50, it really just took me down. I'm very active on a regular basis. I work at a couple of jobs. I run a nonprofit organization, and so all those activities were shut down. My full-time career is a radio personality, so I had to think about my coworkers in the studio using the same microphone. I had to think about my sister who has a chronic health condition, and I actually did pass along the influenza virus to her as well. And so it was just really difficult. I wish I'd had some protection from the symptoms, going from being very active to being not able to move much, body aches, fever, nausea, just a really awful time, low energy. It was real. And then in the back of my mind thinking, this could possibly affect my breathing. How am I breathing? Am I breathing okay? Is this going to trigger asthma symptoms? Am I going to have to be hospitalized? It was a very traumatic time, and so I wish I'd had that flu shot. So that's why I'm here, to try and help others realize that, yeah, I'd rather have that protection and possibly lessen the symptoms than to have to go through what I went through again. It devastated me and just took me way off my game. It shut me down.
Can a person like JoJo, who has asthma, be more severely affected because the asthma? And how about other respiratory illnesses?
Well, unfortunately, you mentioned you're from Michigan. In the winter, we do see people in more cramped spaces. They're not getting outside. The viruses get spread more easily. And so really for any patient that has, say, a chronic lung condition, we see a lot of hospitalizations due to multiple viruses, including not just including influenza. So there's rhinovirus, enterovirus, parainfluenza, et cetera. But unfortunately, we don't actually have vaccinations for a lot of the respiratory viruses, but we do have vaccine for influenza. And that's fortunate because influenza is, I think, of the viruses that we see, I think, one of the most potentially devastating. So I think we are fortunate that we do have something that can offer some protection.
All right, JoJo. So as an on-air personality, do you educate your listeners on how to prevent the flu?
Absolutely, as much as possible, because we have the flu vaccine that's available. I would rather encourage people to get that and perhaps lessen the symptoms, if not just prevent it altogether, than to have to go through some of the symptoms that I went through. And I realize that I have that platform as a radio personality, and so I plan to use it to help others. And yeah.
And as a former Michiganders, I know there's plenty of flu going around, huh? All right, thank you ladies so much for joining us this morning and educating our viewers to the My Shot campaign and the importance of staying healthy to avoid the flu virus.
Thank you,
Thank you, Rosalie.
In the last flu season, nearly 80,000 people died from the flu, and over 950,000 people were hospitalized due to the flu and flu-related complications. Beyond those devastating numbers, people with chronic health conditions and flu infection are at an increased risk for serious long-term complications. Here to discuss the impact of flu on individuals with chronic health conditions and the importance of getting vaccinated against flu each year is Dr. William Schaffner, Medical Director of the National Foundation for Infectious Diseases. Good morning, Dr. Schaffner.
Good morning, Rosalie. Good to be with you.
Doctor, tell us about the mission of the National Foundation for Infectious Diseases.
Yes, the NFID actually is devoted to providing good information about the diagnosis, the prevention, and the treatment of infectious diseases, both to the general public and to members of the medical profession. So we're an educational institution, Rosalie.
And interestingly enough, the media never talks about the medical providers. They're the ones caring for the sick, and they're right there on the front lines.
They certainly are, and they need continuing education, just as the general public needs to be aware of what's happening in the infectious disease world.
So why is it so important for adults to be more aware of the risks of influenza?
Well, exactly the people with, let's say, heart disease, any kind of lung disease, and diabetes, for example, most of those people we have discovered aren't aware that they're actually at increased risk of the serious complications of influenza. And by complications, I mean having to get pneumonia, needing to go to the emergency room, being hospitalized, and frankly, dying. So we would like to urge those folks to be aware of this and then to get vaccinated, because vaccination against influenza remains the single best way to prevent influenza.
All right, so doctor, how do you go out to advocate to those with chronic health conditions that they must go out and get that vaccination?
Well, let me give you one example. People with heart disease, most of them don't recognize that in addition to the influenza itself, they become at increased risk, 10 times the increased risk of having a heart attack shortly after influenza strikes. And this increased risk of heart attack actually stays with them even after they recover from influenza for a subsequent 2, 3, and even 4 weeks. So by informing people of these increased risk of having more serious complications, we hope to encourage them, indeed motivate them, to go out and get vaccinated.
Do healthy people like myself need to be vaccinated?
Many healthy people can deal with flu very well. They get better fine. But every once in a while, the influenza virus can strike a young, healthy child, a young, healthy adult, and likewise put them in the emergency room in no time. Now, there's an additional reason. If you get vaccinated, you're much less likely to transmit the virus to others, to spread it, and those other people may get seriously ill. As I like to say, none of us want to be a dreaded spreader. So let's get vaccinated to protect ourselves as best we can and also to protect everyone around us.
You mentioned risks and complications. Explain this.
And by complications, I mean having to get pneumonia, needing to go to the emergency room, being hospitalized, and frankly, dying. So we would like to urge those folks to be aware of this and then to get vaccinated, because vaccination against influenza remains the single best way to prevent influenza.
All right, doctor, so where can our viewers learn more?
Go to nfid.org/flu, full of good information.
Thank you, doctor, for educating our viewers to the facts of the annual flu.
My pleasure.
Diabetes is a serious disease that affects over 29 million people in the U.S. Type 1 diabetes can develop at any age, youth to adults, and it must be managed carefully or can increase a person's risk for other serious medical conditions. A recent national survey shows despite progress, adults living with type 1 diabetes, or T1D, struggle with the disease and stress in their lives. The good news is 70% of endocrinologists and adults with type 1 diabetes say recent advancements offer hope for a cure. Joining us to discuss type 1 diabetes new advances is Dr. George Grunberger of the Grunberger Diabetes Institute, and he's also the past president of the American Association of Clinical Endocrinologists. Good morning, doctor.
Good morning. Thanks for having me.
So a new patient comes into your office. How do you start the process to evaluating them to determine if they have type 1 or type 2 diabetes?
Well, thanks for asking, because you pointed out of the 29 million people in the U.S. living with diabetes, a vast majority of type 2 diabetes, about 90%. But the reality is that people with type 1 diabetes are constituting about 1.5 million of these patients. And the incidence of type 1 diabetes is also on the rise, not just in the U.S., but everywhere else. But your question was, how does one distinguish that? Because all diabetes has in common the fact that those people have high levels of blood sugar, which lead to those dreaded complications. What's different about T1D or type 1 diabetes, that it's an autoimmune disease which results in complete destruction of the cells which make insulin. There are cells in the pancreas which make insulin. So not having any insulin available means these patients are dependent on insulin for the rest of their lives. People with type 2 diabetes might not make enough insulin, but they still make some. Insulin they make is not working properly. So the major distinction is the complete dependence on insulin for people with T1D. To make the distinction, if I see a new patient, basically one needs to have a blood test done, and those tests can actually distinguish two diseases because those patients with T1D make antibodies which can be measured in the blood.
Is a person born with type 1 diabetes?
Everybody's born obviously with the genes which their mother and father gave them, and both types of diabetes have, people inherit those genes. It's not really clear what triggers that condition in people with T1D. So you're born with, not with the disease, but the genes which give you that condition eventually. And then once that genetic predisposition leads to an attack which destroys the cells, one gets the disease. And even though it used to be called as a childhood or juvenile type, people realize you can be afflicted with that at any age. So yes, there's increased incidence in adolescents and the teens, but you can be of any age and still come down with type 1 diabetes.
Were there any surprises found from this survey?
Well, the surprising survey was actually how excited both the physicians and patients were that the advances will lead to a cure. So that was, I guess, heartwarming in a way. But the other one, maybe not such a surprise, is, again, the illumination of those unmet needs that in spite of the excitement, most surveyed felt more needs to be done, both as far as more discoveries, but also just the things which can make their lives a bit easier, and really to emphasize the stress managing the disease today still brings. And I think that really highlights the need for physicians to share their knowledge about those advances with the patients, but also for patients to let their physicians know specifically what is it in their daily lives that need help with.
So where can our viewers find more information on diabetes management?
For more information about this survey and implications, the viewers can go to GoBeyondInsulinAloneT1D.com.
Thank you so much, Dr. Grunberger, for joining us this morning to share the new advances to successfully treat type 1 diabetes.
Oh, thanks so much for having me.
Did you know taking a vacation lowers stress, reduces the risk of heart disease, gives a better outlook on life, and offers more motivation so that when you return, you can achieve your goals? So if you're overworked, stressed out, or mentally drained, think of the benefits of a relaxing and pampering vacation. According to a 2018 Cruise Line International Association report, an estimated 28 million people are expected to take a cruise vacation this year, a new industry record. Joining us to discuss the growth of cruise vacations and new accommodations is Andy Stewart, President and CEO of Norwegian Cruise Lines. Good morning, Andy.
Morning, Rose. How are you?
Andy, you're celebrating 30 years of building the Norwegian brand while strengthening relationships with travel partners. Share with us how you have seen the cruise industry change in the last 3 decades.
It's changed so much since I joined the industry back in 1988. The ships were much smaller in those days and had relatively few choices. I think we delivered a great product, but it was basically one restaurant and one show lounge. Those were your choices. Today, we're building ships that are carrying 4,000 passengers. They have 20+ dining choices, multiple entertainment venues, offering full Broadway productions, the things that we're putting on the top of the ship these days, including, would you believe it, a racetrack. We have a racetrack where cars are whizzing around the ship at 30 miles an hour on the top of our two new ships, Norwegian Joy and Norwegian Bliss. So I can't tell you how much the industry's changed, Rose.
All right, so with 28 million people embarking on a cruise this year, why the increase of popularity of people hitting the high seas?
You know, I think there's a number of reasons. One is value. It's a tremendous value vacation. And there's a choice for every budget. And so I start with value. And then I think about the destinations we're sailing to. You know, we're sailing all over the world. We have these two new ships, Bliss and Joy in Alaska. We have Bliss coming down to Miami to sail out of Miami, your hometown. We're sailing all over Europe with ships out of Copenhagen and Barcelona, Rome, and Venice. So really destinations all over the world. And lastly, I would talk about the ships. The amenities that are on these new ships are just mind-blowing. And so really bringing in new to cruise, people who haven't cruised before and are hearing about these ships and saying, really, it's a cruise ship?
So do you believe consumers are ditching traditional land-based vacations for all these great amenities?
Yeah, I absolutely believe that. I believe we offer incredible value, and then the guest satisfaction scores for cruising are the highest of any vacation option that I've ever seen. So there's no doubt in my mind that people are trying cruising for the first time, and once they try it for the first time, they'll cruise forever, because it's just such a fantastic experience, and then they can go from destination to destination. So absolutely, we're bringing in new to cruise, and we're bringing people back again and again and again.
So Andy, how is the cruise industry responding to the increased demand for cruise vacations?
Well, you know, I talk about that because when you think about the evening and the idea, I've got to get a cab, I've got to get an Uber, I've got to figure out the restaurant, where is it, how do I get there, how do I get back? On a ship, you don't think about any of that. You pack and unpack once. You pick a different restaurant every night, but you don't have to worry about how to get there or how to get home. You pick a genre of entertainment, and again, you don't have to worry about, am I going to, how do I get there? Will I be on time? It's all right there, and full Broadway productions, late night comedy, anything and everything you can think of. So it's really, it really is a hassle-free vacation of the highest quality to destinations all over the world.
All right, so Andy, where can we find more vacation choices to whatever floats our boat?
NCL.com is our website, and there we have information on all of the different ships, all of the destinations that we sail to, and all of the amenities on board the ship. So I'd encourage your viewers to go to NCL.com.
Thank you so much, Andy, for joining us this morning to share the findings of the new report from the Cruise Lines International Association and the unique new features on Norwegian Cruise Lines.
Thanks for having me, Rose.
Prevention is the key to being healthy and keeping our families safe in our home as well. Healthcare advances benefit all of us and are vital to living a greater quality of life. Preventative use of vaccines are a healthcare option to protect ourselves and those around us. Share with us your approach to keep yourself and your family healthy and safe in your home at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. And watch this episode and many others 24/7 at RoseleeArcherShow.com. Thanks so much for joining us this morning, and we look forward to seeing you soon.